It presented initially for non-specific clinical signs, had a couple of seizures previously, and then they did the bile acids, found that they're elevated. We've just done a CT scan this morning, found that there's a large extrahepatic portosystemic shunt, and so we are going in, we're going to put in a ligature on it. I'm not sure whether we're going to use an hemorrhoid constrictor or cellophane band, depending on the size of the shunt. It's a small dog, but it's a big shunt. So usually with the smaller dogs, we like to use cellophane because it's not as heavy. But with the big shunts, we like to use hemorrhoid. So we'll see what we get when you get in there. If you haven't already done so, please subscribe to our channel. Make sure you turn on notifications so you'll get a ding on your phone the next time we live stream. So midline abdominal exploratory. Dog's getting a little bit light. Going to give some Alfax. So this dog was hypotensive, as in low blood pressure before surgery, and so we've had it fairly light on the anesthetic, but now that we're starting the procedure, it's getting light again, so we'll have to give it some additional induction anesthesia, and we've turned up the fentanyl CRI to try to keep it asleep. Oh, sorry. So going through the midline linea, we can see the falciform fat. Still light here. You've given a Alfax? Okay.
Hi from Chile and good evening from Toronto.
Still light. So you did give Alfax? Might be worth giving a little bit more. So given that this is a small breed dog, just a quiz question for everybody who's watching, is this more likely to be intrahepatic or extrahepatic? Probably already heard what it is, but is that typical for a small breed dog or not typical? So do small breed dogs typically get intra or extrahepatic shunts? That liver looks pretty abnormal. Just being careful not to go through the diaphragm. Not catastrophic if we do, but it's something that's better avoided if we can.
Take a biopsy on exit.
Yeah. So Shauna's just asking if we'll do a biopsy on exit, and that's exactly right. We always biopsy our portosystemic shunts to confirm the diagnosis, make sure there's not microvascular dysplasia as well. All right, so we've got a abnormal looking liver. Diaphragm is intact. Palpate the gallbladder. It's fairly dilated, but palpating or expressing easily. So feel the stomach here. We've got the right limb of the pancreas. Using the duodenum as a retractor, we can see the vena cava here. Portal vein is there. Pancreas, kidney. This dog is intact. Let's call the owners and see if they want her spayed. So I'm just following the caudal duodenal flexure. Into the jejunum. Got a big mesenteric lymph node, which is not uncommon in these dogs. And we're just running the bowel. Again, we've just discovered that she is intact, so she has not been spayed, so we're going to contact the owners to see if they want her spayed, and she probably should be, given that she has a congenital abnormality. Momentum is covering up the intestine here. So getting down into the cecum, and then we'll pull the spleen out, and using the colon as our retractor, we can see the left adrenal gland. I can see the portosystemic shunt right there. Oh no, sorry, that's phrenico-abdominal vein. And we've got the ureter, and we've got the left ovary there. All right, so the way that we find the shunt is we retract everything caudally, and then I'm going to tear through the omentum, and then just look down in the little hole down here in the epiploic foramen, and that's usually where the shunt is going to sit. So that's the shunt right there. I don't know if you guys can see that. So that's the big shunt sitting right there, and that's a monster. So I'm just going to pack this off. That is a big shunt. I hope you guys can all see that. Have you put a hand back here, please, Sean? Both sides. All right, so now Sean is isolating the shunt really nicely. And now I need to carefully dissect around it, because if I tear this shunt, that is pretty much the end of the road for the dog, because this is such a big shunt that we would not be able to ligate it acutely. So I just have to be really careful with my dissection. And this is so big that I am going to put an hemorrhoid constrictor around it. All right, so, and I have to be really careful when I come around the back side of the shunt so that I don't tear it. Thank you. All right, so I'm just going to open this up a little bit. So I've got the shunt sitting here. Can I have an 8 mil constrictor, please? 8 mil constrictor, please. Thank you. It should be here. It should be here.
Okay, sorry.
Yep. Go ahead and spay her. Yeah. That one, big one. So the owners have given consent for us to spay her, which is totally appropriate. All right, so here's our constrictor here. This is fairly loose. Can we get another one, please? This is too loose. So the casing is falling through. This was probably autoclaved too many times. I'll save this key. A bigger one, yeah. This is quite an old one. Yep, that's what I need. Yep. Just getting a new 8 mil constrictor. One of the big advantages of working in a big referral center like ours is that we have multiples of everything, and so if you run out of something or you drop something, you always have more. So here's our constrictor here. I'll just grab that with a thumb forceps. And I'm going to elevate this. Try to pass it underneath. Yeah, that's fine. All right, so we've got our constrictor around the vessel. And it's constricting it a little bit more than I like just because of the soft tissue that's incorporated. So I'll try to release that a little bit. I'm just opening up that soft tissue. Okay, so that's a little bit bigger now. And then I just need to grab this key. So that's the key right there. And if we lose that key, hopefully we've got another 8 mil constrictor, but that's still a big problem if we do that, or pain if we don't have one. All right, so now I'm going to pass the key. Into the constrictor like that. And that's pretty much it. So now we're just going to reposition our balfour. And so I'm happy with that. And then we're just going to do our spay. Can we get our spoon on the... They can probably start on our next patient. Yeah, thank you. All right, so...
Or ligashore or just...
I'll use ligashore, please. Can I get a ligashore? Because I'm lazy.
Get that plugged in, please. Thank you. It's not plugged in just yet.
Yeah. So in Adelaide, we've got an even newer model of ligature, and surprising to say, it is even faster than this one. So about twice as fast with each ligature.
Damn. That's already pretty quick.
Yeah. And then I'm just going to transect the uterus. I don't mind if I'm leaving a bit of cervix. Because we're taking the ovaries out, the risk of stump pyometra is virtually zero. So, all right, and then let's take a liver biopsy and then we're done. Can I get a, yep. Get a pot, please?
Can you get a histopot, please? Yep. Thank you.
So that's our biopsy there. All right, and I'll have one last look at our shunt.
Can I get 2 0PBS, please?
Where's our hole that we created? Up here, thank you. All right, so that's sitting there pretty nicely. All right, so let's go ahead and close. We're also doing brachycephalic airway in this dog. So we'll do that afterwards. I don't think I'll live stream that because it's hard to get the camera in position. So I will do a simple continuous suture pattern. No problem with doing simple continuous in the abdominal wall if you're comfortable or confident in your knots. So I always do simple continuous. One of my proudest moments was my son told me that he was at a party, and about 11 o'clock he went down into the basement and a bunch of his drunk friends were sitting around watching my YouTube videos.
Proud dad.
Yeah. I beg your pardon?
Do you want coblation for the lower side?
We don't have coblation anymore.
Really?
Yeah.
I'm so late to the party. That's my question. I do that. Yeah, man. Why? We just get rid of it.
I will discuss it with you in a minute after the live stream.
Yeah, it's a fancy little thing.
I was really the only one that used it.
Yeah.
Right.
I only used it once with you, my boss. And I was dreading setting it up. You all laughed at me. Because I was panicking.
So are we doing the boas in here, or are we moving out?
We'll do it in here. Everything's here.
Ready to go? I just need a Satinsky.
Yes.
Thank you.
Do you want your adrenaline and leak?
Yes, please. Get some 3 ammonicin, please. Yes, I am. All right, so I'm going to leave. I'm going to close the rest of this. Again, if you haven't already done so, please subscribe to our channel. Make sure you turn on notifications. Hopefully I've got some more stuff to live stream this afternoon, but we'll see how we go. And N2 has commented, coolest dad ever, which I think is true. You just have to ask my kids. They would definitely agree with you. Yeah, we'll go from there. So thanks a lot for watching. Again, if you haven't already done so, please subscribe to our channel. Make sure you turn on notifications.